Okay, we're recording. Good afternoon, all of our parents and our families. We're going to start our second training, which we're really excited about, on meals and snacks. I'm Megan Guthrie, and we have Megan McDevitt here, and our OT supervisor, Heather Fantini, has added in some stuff, but unfortunately, she's not here with us today. All right, we'll go over the agenda. We're going to cover some ground rules. We're going to go over keeping it positive, meals and snacks, some resources that you can click on the links, and then we'll close. Feel free to email myself or Megan with any questions, or you can talk to your classroom teacher and they'll forward them on. Megan?
All right, so some ground rules. Things are going to be a little bit different because we are recording, so families aren't on right now, but we will start and end on time. We will, obviously, we're not sharing, but if you have anything to share or anything that you'd like to, have a conversation about, you can feel free, like Megan said, to reach out to us. And see, yeah, and we're going to be as respectful as possible and try to really address some of the different issues and needs that you may have. But again, feel free to reach out if we don't cover anything. If you want to expand on anything that we didn't really explore in depth.
Okay. This is the first part of keeping it positive. So we're going to start with this first activity. You should have gotten a copy of the activity from your classroom teacher in their backpacks, but if you didn't, feel free to just get a piece of paper now and you can write down your affirmation. So what is an affirmation? It's a positive reminder or statement about yourself that's encouraging and motivating. Anytime you learn something new, including today is going to be new information, it can be challenging. And we want to start each session by encouraging you to take a moment to reflect on the changes you've made and your efforts that you're making with your child. So we'll watch a short video, and then if you could pause this video after watching it and take some time just to write what would be your affirmation.
Finally, the 3-year-old who is definitely America Strong. It's the moment moving so many. The simple walk to school, the 3-year-old named Aeon wearing his backpack and remembering the words his mother taught him at just 2. What he says to himself over and over again.
I am smart. I am blessed. I can do anything. I am smart. I am blessed. I can do anything. I am smart. I am blessed. I can do anything.
That's his mother, Alyssa, and she and his father, Alpha, have been telling their little boy for some time that he will grow up to be anything he wants to be. This was one of their first lessons more than a year ago.
You say, I am smart.
I'm smart.
I am blessed.
A bus.
I can do anything.
I can.
He'll get there. 1 year later, now 3 years old, declaring this.
I am smart. I am blessed. I can do anything.
Great parents, great little guy.
So if you're watching the video, take some time now, pause the video and write down your affirmation. Megan?
All right. So how to have fun in everyday moments. So we do, like we talked about a little bit last time, sometimes we do get caught up in our days and our routines, and we forget about the little moments where we can kind of incorporate, maybe fun moments or like learning opportunities, playful interactions. So when you increase those positive times that you do have with your child, you can strengthen your relationship, which will make it easier to teach your child new skills and behaviors. So like we said earlier, learning new things can be hard. So be intentional about using positive comments, providing encouragement, and spending time with your child. So we did get a little bit into that last week, but more specifically, here are a couple examples of some playful interactions that you could have just throughout the day with your child. So, if your child is brushing his teeth, you can talk about what they're doing in the sense of, oh, look, he's got a toothbrush. He's reaching for the toothpaste. It looks like a slam dunk. That toothbrush is in his mouth. Look at him go. Look at him brush. The crowd goes wild. Just kind of, making normal everyday things seem a little more exciting can increase that engagement with your child, and turn those things into, that might be tedious tasks, makes it a little more exciting for them. You can also encourage your child's creativity and imagination. So really following their lead, and allowing them to, and encouraging them to be creative and imaginative. If you're at the store and you see something, you can pretend the boxes and cans are spaceships flying and landing in the cart. Just a little example. Try to avoid power struggles. So you can pick a game to play together and give them a few different choices, so that it does seem like it's their, it is their choice, even though you're providing the different options for them. It kind of gives them that sense of responsibility and helps them take ownership in their play. Also, having fun together in everyday moments can just be turning on music and while you're doing something like emptying the dryer, or throwing the things from the dryer into the basket. And those little tiny moments can be huge in throughout the day.
Next topic we're going to cover is related to social emotional skills, where we're going to ask the question, does my child have the needed social emotional skills? To better understand challenging behavior, it is helpful to think about these social emotional skills that will help children develop as they grow. We tend to spend a lot of time thinking and planning and helping kids learn academics like ABCs and 1, 2, 3 and shapes and colors. But we also need to be really intentional about teaching social emotional skills. And some of those skills are going to be feeling confident. Are they proud of their work? So that could even be related to, are they proud of their coloring that they did? Developing strong relationships with others and making friends. Do they have friends in their classrooms? Are they making solid and positive relationships with their teachers or your friends at our home or their aunts and uncles or their grandparents? Are they persisting when tasks get hard, and are they able to have problem solving steps to be able to figure out, what do I do in this scenario if the step 1 didn't work or step A didn't work? Following directions, it could be from you, could be from someone new. Being able to identify and express feelings as well as cope with strong emotions. Megan, do you have anything to add?
Yeah, so for this one, I think, excuse me, a lot of times, it's normal to feel like we need to focus all on academic skills. And if our child isn't academically at that point that we feel they should be, that it can be, it's scary. But it is really important. And one thing we really, really work on here at school is those social emotional skills. We have plenty of time for academics. They have our whole school career. But a lot of these skills that we're discussing here are foundational skills that are really important to establish when they're young. Some lifelong skills as far as, listed right here, that can go into adulthood and really help them just build resiliency and become overall productive members. And confident, all of these things are really important in adulthood. Also, it helps them enjoy learning when you follow their inclination, their natural curiosity to discover things and explore. That really helps establish and foster that lifelong love of learning. So instead of just sitting and doing XYZ, they're following their what their own curiosity, and their that helps them actually connect with what they're learning and build those strong foundation skills. So this is something that's really important to do while they're young too, because right now is when they're starting to learn how to cope with things, and they're experiencing things that might frustrate them, or again, it builds that resiliency so they can begin to learn how to identify their emotions and acknowledge how they're feeling, and you as families play a huge role in that too. So sometimes I know we try to kind of skip over that emotional piece because we just have to do what we have to do, but acknowledging that is also part of acknowledging their feelings, is also part of what we talked about last week with helping them feel valued as a person and important. And yeah, so that's a really big piece of our day here at school. And it's great to carry over at home too, because obviously the emotions they're going to experience them everywhere. So sometimes it can be, it's always very beneficial to continue to acknowledge and work on those skills in all different settings. So why is my child engaging in challenging behavior? There could be various reasons. Sometimes if your child isn't able to appropriately communicate with language what they want or need, they might tantrum or engage in that challenging behavior. Or if they don't have the social skills to do so, then that behavior may also arise. There may be some variables such as sleep, lack of sleep, hunger, stress, medical factors, or other different expectations across settings. So basically, when your child engages in that behavior, that challenging behavior over time, it's because it's working for them. So they do it because it works. And if it ain't broke, don't fix it. So they kind of are like, well, let me continue doing it this way because I get what I need. I get, the attention, or if they're trying to obtain something or avoid something, they've learned that works for them. So basically, behavior is meaningful and it communicates a message. So we might be frustrated or not like the message that they're communicating to us, but we can identify and understand it. So if your child has a tantrum in the store because you told them they couldn't have a toy, we can recognize that behavior is saying, I want the toy. So that's a really simple, basic example. But that's why it's so important that when we do reinforce them, that we reinforce the appropriate behavior consistently, so that we're continuing to keep that same. They're recognizing that, oh, I did this way, I did this, and now I get this, I have this response, and they continue to engage in the behaviors that you want them to engage in, rather than the ones that are tough and kind of can be frustrating. So there's always a meaning behind their behavior. Megan, you want to add anything?
And we're at our second activity. It's called encouraging positive behavior. So if you have a copy of this, pull it out. If not, don't worry about it. You just need a piece of paper and a pen. So think about some behaviors that you would like to see more of, and behaviors that you would like to see less of, and ways that we can encourage your child to use those positive behaviors more. So take a few minutes. If you're watching video, pause here and write down what you would like to see a change. So more of, as examples, more listening. I want them to help clean up, eating at the table versus roaming. I want to see less of hitting their siblings, screaming, ignoring me. So again, pause the video here and take some time to fill out this. How to keep it positive and make it clear. So the way that we talk to our children can have a huge impact. Even though we might be saying things, the way that we say it is almost a little bit more important. When children engage in challenging behavior, a common reaction might to say, stop or don't do that, which it inadvertently reinforces us because maybe they do stop or maybe they do that behavior. So it's telling us what we're kind of talking about before, that's working for us. But in the future, it may not work. So these statements can also lead to feeling frustrated or challenging behavior for both you and your child. If you said stop or don't do that and you say it a couple times in a row and the child doesn't stop or they don't stop doing what they're engaging in, that can lead to a lot of frustrations, both for us and for the child, because the child's not really sure what they should be doing. So again, that kind of leads into our next part. What we want to focus on is telling our child what they can do. So if you're saying stop, what is the stop for? Maybe I want them to stop jumping on the couch, but what's the other option? Are they able to play outside? Can they watch TV? Can they jump on the ground jumping jacks? You know, is there a trampoline nearby? What are the things that they can do that's appropriate and is going to give them positive praise? So we want to use positively stated instructions and state our expectations so they're clear, and also maintain boundaries. So some clear expectations might be keep your hands and your feet to yourself. It's clear, it's direct, it's pretty short, sweet, and simple. But I'm also maintaining boundaries. So I'm saying this is my space and that's your space. And we need to keep our hands and our feet to ourselves so we stay safe. Anything to add?
Yeah, with that, I think it's important also to note that just because we are, you know, being positive and maybe giving choices, that doesn't mean that we're not still setting those boundaries and those clear, strong boundaries. We can still have expectations and, you know, maintain those boundaries, but we can do it in a positive way. And it does take some practice. It can be, you know, it's natural to react one way. We're almost reteaching ourselves how to react, which can be very difficult because, you know, we're used to doing things one way. But I think the more you practice and the more that you, you know, really consistently use it throughout the day, it becomes easier. And we also have a nice resource about some ways we can use language when we are, you know, encouraging. Now, this isn't necessarily expectations, but some of them are. So instead of saying be quiet, we can say we're going to use a softer voice. Or instead of what a mess, we can say it looks like you had fun. How can we clean up? So this resource will be attached to, but it gives you some ideas as to how you can kind of rephrase things. And you may not even think that it would make a big difference, but it really, it kind of framing things in a positive way does help positively affect their behavior, especially in the long term. All right. So continuation on that. Activity 3 is using positive words. So when giving directions, we want to, again, tell children what to do. Use short and simple phrases. So not too much wordage where they kind of just hear, you know, they might get a little bit lost when you give them too many directions. Pause and allow for them to respond. Some of our kiddos have some processing delays, or it might take a few seconds, you know, where we might be able to respond quickly. They might take a little bit longer to kind of process everything. And then also provide support and encouragement. So here on the left, we have a few examples of things that we might say, we might be used to saying, like, don't run. But instead, we want you to think about how you can rephrase that in a different way, in a positive way. So maybe instead of saying don't run, you can say use your walking feet. It's just one example. So you want to tell your child what to do, use simple words and phrases, and you can even show a picture of the action or model it for them, which is always great. Modeling is always great to help them, you know, give them that visual expectation, especially if they do have difficulty with their receptive language or their ability to understand what you're verbally saying to them. So take a few minutes to review the statements under avoid this and write down alternative phrases to use under the column say this instead. So you can just pause here and take a few minutes to do this activity.
And our last activity is going to be for you to try this at home. So if you don't have this paper in front of you, you can just use a piece of paper, and you're going to kind of jot down how many times you've stated something in a positive manner. Try this over for the next month or for a week or even for a day, just to see what that would look like. And then the positive things that you've said so that you can remember for next time. So maybe you are really proud of yourself. Remember those affirmations. You are really proud of yourself for stating in one day, over 10 things positively. And these are the things that you said, remember, use your walking feet, keep your feet on the ground. I'm so proud of you. Look how safe you're being, all those wonderful things. So again, pause here. And if you don't have the paper, jot these down and then keep track over the next, like I said, if you want to do it for a day or a week or the next month, and we can talk about it at our next training. And we're going to get into meals and snacks now. We are taking a behavioral approach to feeding. So please note, if you do have any feeding concerns for your little one, please do get a full feeding evaluation. It's something that we can do here at Easter Seals. But again, if you have any concerns, especially if your child has a specific medical or sensory feeding issue or just any concerns in general, please do get a full feeding evaluation. Again, we can do that here at Easter Seals. The following slides are going to be taking a more behavioral approach though. Megan?
All right, so some common questions when dealing with the topic of meals and snacks and mealtime. Number one, does your child have restricted eating preferences or food sensitivities? So, that could be, that they don't like a certain texture or sensory, sensory wise, they don't really like certain feelings in their food. Number two is, will your child sit to eat, or will they roam around and eat while walking around the house? There are definitely some very consistent strategies you can use to help them stay in their seat. We'll talk about a couple of those. And then number three, is your child silly during snack or meal times to get your attention or the attention of others?
So we're going to go over and just quickly review the steps to eating when we're introducing our new foods. There's about over 30 steps when we're introducing new foods. So if you think about it, it's not just I'm going to present broccoli one time and they turn their head or they push their plate away. I'm never presenting broccoli because they must hate it. If you think about it in all these steps, it starts from just tolerating. We're going to use broccoli as an example here, tolerating broccoli being remotely in the room and kind of going to, maybe they touch it with one finger, then they're kind of touching it with the tip of their tongue, and then it goes to biting off a piece or taking a drink, or they're allowing the food to be swallowed versus spitting it up. So it needs to be presented several times in the same manner over and over again to kind of get through all these steps here. So again, if your child is a picky eater, if we're taking a behavioral approach, continue to present it without kind of forcing for them to touch or eat it, but just allow it to be either on the plate or in the room. So it could be on a bowl in the middle of the table, and you're just allowing it to be in their shared space, and kind of slowly work your way up to it being on their plate, or they're touching it, or maybe you create sensory play. But please note that it is okay from a behavioral standpoint. If they are pushing it away one time, just continue presenting it. Megan?
Yeah, and sometimes it can be kind of counterproductive when you do force them to eat, or force them, because they're maybe overwhelmed. They may have those sensory issues with it. So our goal is, at the end of the day, to reach that bottom, have them actually bite and eat. So if we're pushing it and trying to shove it down their throat, that's going to deter them at the end of the day. And it's going to end up being a negative, they're going to have a negative connotation with the broccoli and with mealtime sometimes. So we want to be patient. It can feel frustrating. It can feel like eat it. Like, this is what we made for dinner. This is what you're having. But sometimes that, again, that can be counterproductive. So we want to be a little bit patient, and really follow your child's lead, kind of see what they're doing, how they're responding to things. You don't want to push them too fast, but you also don't want to let them do whatever. So just really pay attention to how they're interacting with the food, and use some of these steps. You can kind of go through them to help them reach that, that ultimate goal of eating that food that they might not like.
So if you need to, and you are wanting to try this out, I'll go to each slide and you can pause. But here's the first slide. Here's the second slide. And here's the third slide. And this is more of the avenue if you went to a feeding clinic that they might take. So here's preventing the behavior. And I think, Megan, you're going to go over this, right?
Yeah. So obviously we want to try to prevent the behavior before it even occurs. So everything that we can do before actually even having this interaction, we want to do, so we can set them up for success. So number one, one idea is to allow your child to be the helper. So have them help you prepare the food, set the table, call the family for dinner, or whatever it may be. That really gets them involved in the process and helps them, kind of buy in more to mealtime overall. Number two, offer food and drink choices during meals. You can show them, you can have visuals where you're offering them the choices, or you can show them, this is barbecue sauce, here's ketchup. They can choose with it in there right in front of them. And sometimes it might feel like they're kind of taking control if you're giving them choices, but give them choices that you're okay with. And then again, they'll feel like they have some responsibility, and they feel like it's not as terrible of a task, because they had a part in choosing. Number three, modify your expectations. Allow your child to pick one non-preferred food to try, touch, or simply allow it to be on the plate. So for this, I think it's important to know that you're not letting them off the hook necessarily. You're not letting them get their way, but you're rather starting small, again, not to overwhelm them. And you don't want them to shut down. So you don't want to push them too much, and then again, it's counterproductive. So modify your expectations a little bit, and that might be tough in the beginning, but you'll see that in the end, it does help them tolerate things better, and they don't feel as backed into a corner sometimes. But they're still doing what it is that you want them to do, and eventually, building that and getting to where we want them to get. Number four, provide praise for eating or trying new foods. Again, we always provide positive praise for everything that we see them doing that we want to see them doing. So we call that kind of catch them being good. So that goes for, throughout the whole day, but continuing to praise them when they do what you want them to do. That is a really simple way to continue to positively reinforce them, the positive behavior. Number five, help your child say all done, and then let them out of this meal or snack for an alternative activity. So having a final, like a closing point to mealtime is good too, because it really helps them, they realize that they're appropriately saying that they're finished, and that mealtime is over, and then they can go participate in something that they like to do, maybe like a preferred activity, or spend time with, whatever they like to do. Number six, make meals a part of your daily routine. Work it into, again, structure routine is very important. So the more that they go through that routine, the more familiar they'll be, and the more successful they'll be. Number seven, make mealtime fun and engaging. Talk to your child, look at a book together, or play a game. So whatever you feel you want to have at the table, if you want to have a book or play a game while you eat, that can be a great way to make it fun. And then it's not just about, that scary mealtime where I have to eat things that I, might not want to even look at. And it's a great way to build positive relationships too. Mealtime's an awesome time for that, because you're in that, they're in that setting, you're sitting, you're engaging in the same activity, in a sense. So you can model in that time, you can, just have some really good interactions. And then number 8 is offer your child assistance if they're still learning to use utensils. So give them a little bit of help if they need to. You don't want them to get frustrated or, so just really provide that support when needed, to try to prevent all of these things that really help prevent that behavior.
Our next topic we'll talk about is how to respond. And there's about 7 things we'll talk about. So the first one is introduce non-preferred foods alongside preferred foods. And Megan kind of talked about that in giving them a choice of what non-preferred. So maybe non-preferreds are broccoli, corn, and rice. Maybe we provide them an option. Okay, these are 3 things. Maybe they don't like it as much, but we're giving them the option. And then while we're providing that choice in a non-preferred, we want to then pair it and put it next to a preferred thing. So maybe they can have broccoli, which might be a non-preferred, and they can have pasta, which is a preferred food. And kind of by providing it together, the hope would be that because I've always paired or put broccoli next to macaroni and cheese, which is a preferred food, that I will then hopefully like broccoli because I also like mac and cheese, or they can mix it in together, however you present it. Please note that we don't expect them to eat the broccoli, even though it's paired or put next to the mac and cheese. We're just presenting and building up their tolerance. So if you remember back to a couple slides ago, we talked about having broccoli in the room and then having broccoli on the plate and then touching broccoli. Maybe we put our tongue on the broccoli. And the next step is to take a little bite of the broccoli. And then maybe the next step is we actually swallow the broccoli. So even by putting it next to mac and cheese, which we love, doesn't necessarily mean that they have to eat broccoli. We're just allowing it to be on the same plate, which kind of goes into avoid force feeding, offer alternative choices. So we were kind of talking about before what Megan was going over. Maybe they don't like broccoli, rice, or corn, but you're providing the options. Allowing them some, I think Megan said, ownership or responsibility over what foods they want to eat. Comment on other sitting and eating. So maybe you do eat as a family or as a group in one space, and other people or other kids their age are eating. Comment on those. Oh, I see Josh is eating at the table. Great job. Look, oh, you're eating corn. Comment or just narrate on what you see around you. Restate the rule. So if your rule at home is to sit and eat, just restate that rule. That may not be your rule at home, but again, if it is, restate that rule or whatever your home expectations are around mealtime. Have your child state that they're all done. So I think Megan also mentioned this before in the preferred method of communication, whether it be sign, vocally communicating, using a picture, using a tablet, AAC device, however they're communicating, and help support them in saying that they are all done so that they can leave and access something else. So again, the idea is for them to kind of build up this tolerance. Again, if your expectation is for them to sit and eat, building up the tolerance to sit and eat, and maybe they sit for 30 seconds and then 45 and then a minute, and you're really building up to, however long your meal times tend to be. Maybe your meal times are 10 minutes. Is your expectation for them to sit and eat for 10 minutes? Start out really slow, start with even 10 seconds, and then build up from there. And then if your child is engaging in silly behavior at the table, just ignore the silly behavior, redirect if possible, and then provide attention to anyone else at the table who is engaging in appropriate behavior, and then comment positively when they end kind of silly behavior. Megan?
All right, and the last slide is there. These are the 5 different explicit objective things that we can teach our children to help facilitate all of this. So like we said, teach your child to say all done. So sometimes you might even just sign all done. But you know, having them that finish, that helping establish that finite end. Teach your child to make a choice. You can do this throughout the day as well, not just at mealtime, but again, it's a great time at mealtime to help them to do what you want them to do. Teach your child to sit for longer periods of time with gradual increases. So like Megan said, maybe not right away, doesn't have to be 10 minutes. It can start small and get bigger. Teach your child to request for your attention appropriately. I know a lot of you probably deal with that on a daily basis. It's, however they're trying to get your attention, but you want to teach them to do it in an appropriate way. So that could be, having them say, excuse me, or, making eye contact, or, whatever it may be. But we don't want to reinforce them tantruming again, because they know that it works. And if we do reinforce that, then they're going to continue to request for your attention in that manner. Teach your child to participate in mealtime by praising appropriate behavior. So pump them up for the things that we want them to do consistently throughout the day. And most children are really receptive to that positive feedback when they do what they're supposed to do. And a lot of times they'll even go out of their way to make sure, and they'll look at you to see if you see them doing the right thing. So, they really pick up on it quickly. And all of this is, like I said, it's going to take patience and practice. It may be unnatural at first, but if you continue to practice and try to be consistent with it, it really does make a difference. And we see that, in the beginning of the year versus a few months into the year, once, they come in, they're not sure of the expectations, even especially, we have a snack here, and they might try to roam around the room. There's toys everywhere they want to play with. They're not, they don't want to, they want other kids' snacks. There's a lot of different factors. And so we have to really kind of start from scratch and see where everybody is, and kind of use these skills, use these strategies to develop these skills. And a few months into the year, we typically do have, we'll have you walk into the room and the kids will all be sitting at the table, but that might have not been the case in the beginning. So just be consistent. And, if, of course, as we said before, we are always here if you have any specific questions about this, or, you're finding that you're running into the same issue or something's working, you can share with us. But these are some really, really great strategies to help, facilitate that appropriate behavior during mealtime.
So we'll send out the PowerPoint, and also we'll send out this video. But here's some resources. There's feeding clinics in Philadelphia. I think everyone is, I think sometimes people are more aware of chopped feeding program, but St. Christopher's also has a feeding program, and TheraPlay has a feeding program if you need other ones. There's a couple of videos that we put on here. Feel free to explore. Parent-child interaction therapy, positive affirmations for kids, 3 ways mindfulness can help, other mindfulness videos, how to get your kids to listen and engage, the TED Talk, what's scaffolding, and then joint action routines. And thank you so much for listening and participating today. Again, if you have any further questions or follow-up things, feel free to contact your classroom teacher, and they'll forward that information either to myself or to Megan. Looking forward to seeing everyone next time.
Thank you so much.